Welcome to the second Health, Edco and Childbirth Graphics mini movie. I'm going to be talking today about smoking. Now, it's one of the leading causes of death in the world. Certainly in Western countries, the UK, US, we've now seen rates drop from almost 50% in men to around about 18 to 20%. That's great. But we still have many people that do smoke, and there are more and more people smoking in developing countries such as China. So, is it really that dangerous? Well, yes, in a word. The chances of you dying from smoking are 1 in 2. So if you are a smoker, you have the same as this heads or tails chance. Have you guessed which it is? Well, we'll come back to this later. I'll just take a look myself now. So, we know it's dangerous. So, why is it dangerous? Well, it's a leaf, isn't it natural? No. A tobacco leaf is dried and placed through many different kind of procedures that tobacco companies do to make that nicotine hit your brain and keep you addicted. If you think about a leaf, if you try to light it, it will just go out. Whereas a leaf tobacco in cigarettes is full of additives, and when it's heated and lit, there are up to 4,000 different chemicals in that smoke. Rocket fuel, rat poison, that's just to name a couple. You've got all sorts of things, up to 65 different carcinogenic chemicals in there that can cause problems. So what does that smoke? We see the smoke, but what happens when it hits the lungs? Well, if we have the toxic tar here, Tarbra, one of our products that we produce, shows you the amount of tar from 10 cigarettes. Now, in a pack of cigarettes there, 20 cigarettes, that's the amount of gooey, carcinogenic, horrible tar that's sticking on your lungs. Disgusting. And what does that look like over a year? Well, a year's worth of tar. This is 10 cigarettes a day over 1 year. The amount of horrible, gooey tar. So, well, okay, if this has hit your lungs and it's, should we say, turning them black from the clean, how does your body get rid of it? Well, there's little hairs called cilia hairs. And they try to get rid of that horrible tar. Now, a lot of it is actually starting to go through the membranes and the alveoli in the lungs, but some of that goo is too big, so it can't. So how does our body get rid of it? Well, smoker's cough. Now, smoker's cough, this is this horrible phlegm. And this is about a month's worth of smoker's cough. And it's disgusting. But where does that go? Well, unfortunately, smokers then swallow this horrible goo full of poisons and eat it. Absolutely disgusting. So what does it do? Well, many things. We know it causes cancers and heart disease and it makes any effects. I mean, straight away you can look at bronchitis because it's affecting the lungs. The damage to the lungs, well, the alveoli can pop and become large. People can't breathe properly. You can look at cancer. This is this almost cheesy substance that occurs, and of course we know that lung cancer is a terrible, terrible condition. Bladder cancer, how can it get to the bladder? Well, those chemicals go through the bloodstream. As I say, you're pretty much eating it as well, so it gets around the whole body. Affects birth defects, strokes because of the way it interacts on your arteries. So I'm going to pull this off our consequence displays. These are interactive consequence displays. You can pass the models around. And what it's trying to show here is fatty deposits. Now, the reason why smoking can actually cause this is because of a substance in smoke called carbon monoxide. You may have heard of it. It's a poisonous gas. It makes your arteries sticky. And in that sense, if you eat unhealthily, or even if you're just general fats, you will find that your artery becomes clogged, atherosclerosis. And as you can see here, we have this model that shows there's a healthy artery, there go your blood cells, and there don't go your blood cells. Now, if that clogs up, you can have heart attacks. Part of it can come off and go into the brain, that's a stroke. But there are other things that people don't realise, such as smoked foot. They've lost a limb, they've lost a toe. Why? Because the arteries going down into those legs have got so clogged up that the blood can't get through. You cannot get your nutrients, oxygen through. So what happens? You can lose a foot. In the UK, there are around about 5,000 lost limbs through smoking. It's around about 35,000 in the US. Terrible, terrible, terrible. So, what can we do? Well, if you stop smoking, the good news, and again we've got a great product here that shows what happens. Within 20 minutes of stopping smoking, your blood pressure goes down. Within 24 hours, you find that a lot of that carbon monoxide goes out of the body. It's gone. So it's not affecting the arteries in the same way. Within a few weeks, that horrible goo stops coming up. Your body starts to clean out. Within 8 to 12 months, your lungs start to clear in a lot better way. Your body starts working better. So stopping smoking is a great thing to do. But how can you stop smoking? Well, evidence says if you just try and stop, you're going to find that very difficult. Best way is to speak to a health professional. You can look to use nicotine replacement therapy. Some people are now using the e-cigarettes. What do I think about those, and what do we think in the evidence? Well, it takes some 4,000 chemicals down to only a few, and especially that nicotine. We can use those for smokers to help them to stop. Is it the best way? No, but it does work, and public health specialists seem to think that it's a good way of doing it. I would say it's similar in the fact that you could get hit by a bike, is the kind of thing, that you can get hit by a bike is the same for an e-cigarette, whereas smoking is a bit like being hit by a car. The chances of you surviving are going to be much lower. So we have all these products, and I'm giving you some information on smoking. And you're probably thinking in the background maybe about that coin, and whether on the 1 in 2 chance, if you're a smoker or you know someone's a smoker, whether they could die from it. Well, the thing is, I'm not going to tell you, because that's the problem. You don't know. You don't know if you smoke whether it will kill you. If you truly want to find out what the answer was when I asked the question, I'll place that on our Health Edco Facebook page and Twitter account. So please do join it and you can have a look. I hope you've enjoyed this little movie about smoking, and please do pass on to people you know. This is one Facebook message or Twitter message that if you pass on could save a life. All the best of health.